Welcome to Allure Alliance Community Health Worker Certification course. This is our live Q&A. So we will get started and walk you through all of our community health worker training and how it will lay out for the next 12 weeks if you choose to join any of our cohorts. Our next upcoming cohort starts February the 10th and will last all the way until April 28th. So it's a long stretch, but it's well worth it. Once again, thank you for your interest in CHW training. We will be your trainers. My name is Dr. Sharita Ambrose, and I'll let Latoya introduce herself.
Good evening, everyone. My name is Latoya Swan. I have been a community health worker instructor, a community health worker, a community health education specialist for over 20 years. I've been working in the HIV field for over 20 years, and I have been the co-founder of Allure Alliance for over 3 years. So welcome, and we appreciate you being here this evening.
Thank you. My name is Dr. Sharita Ambrose. I am the co-founder as well as the executive director of Allure Alliance. I also am a CHWI, which is a community health worker instructor, and both of our backgrounds are in public health. We've been doing it pretty much our entire career, so we are very well versed in the needs of community health work, community health workers, and the community at large. So our agenda is our welcome message, which we just did. A little bit about us as Allure Alliance, also known as the Random Black Girls. An overview of the course, the layout, the expectations, scholarships, payment options, and whatever next steps before our next cohort, or the next steps if you decide that you want to enroll in any of our CHW trainings. And then we'll have Q&A if there are any questions that may need to be answered. You can always email us or you can ask them directly to us. A little bit about Allure Alliance is that our mission is to significantly improve the health and well-being of Black women through community support, education, and advocacy. Our vision is to be a progressive leader in health and well-being education for Black women through providing dynamic and inspiring learning experiences that create positive health outcomes for Black women. So ultimately, what we saw was a gap in services for Black women, for BIPOC communities, and a big emphasis on the being BIPOC, but we wanted to step into that gap and be the bridge. Anything you would like to add, Latoya?
Yes, absolutely. Being a bridge to Austin's community has always been one of our main missions, and we want to make sure that we supply the same tools and information that we received in order to do the work here in Austin to others. So we encourage you to join our community health worker training program. That way you can also be an asset to your community.
So let's begin talking about the CHW, the Community Health Worker course. So the CHW training program is a 12-week Department of State Health Services, that's DSHS, certified training program. So regardless of any CHW program, once you're certified through the state, you're certified through the state. So this is a great starting point to get into the healthcare field. For our course, the first week is an introductory week where you get to learn about us through the LMS, what you're going to be doing, what the expectations are, homework assignments, et cetera, et cetera. And each subsequent week, so about 10 weeks, you will do a lesson, you will do activities, you will do a live Zoom session once a week. We've picked Wednesdays, which is the middle of the week. That can be changed if the entire the cohort has said, you know, Wednesdays don't really work. Can we do another day? And it's a unanimous situation. We absolutely can change that date, but it will be one time a week where you're expected to be on the live Zoom session. That's where we do a lot of the activities and the applicable skills. So you'll do pre-work, homework, and field work hours throughout the week. And then there's one day where we do live in session with the trainers, with your cohort members, and we learn all of those different skill sets and try to put them to work. You have assignments sometimes when they're also live. So during that time, you'll hone those skills as a community health workers. Often people feel like, oh, I don't have that experience. Well, this is where you're going to learn it. And this is where you're going to practice it. Because I honestly believe what you do in practice, you do in play. So what that means is when you get into a session with us, yes, we're going to challenge you. Yes, we're going to ask you to do activities and work with each other. There's going to be a myriad of experiences in the cohort. So hopefully you'll learn a lot, not only from us, but also from your cohort members. And we also have scholarships available up to 100%. And because this is a hybrid situation where it's fully online, but we do have a face-to-face or live component to it, we ask that you are present for those live sessions. We do make exceptions. However, to fulfill the DSHS requirement, we are required a certain amount of participation. So throughout those 12 weeks, so the very first week, week 1, is very intro. It's welcoming. We ease you in. Then about 10 weeks consecutively, we will have activities. And then that final week, the final week of our session, we will have some makeup work if it's needed, but also we walk you through step by step how to fill out your DSHS application to get certified. And once you're done with all of that, we submit your paperwork and you submit your paperwork and DSHS will send you information about your DSHS number and your certification goals. We have, at this point, we have certified 14 people in the last 2 cohorts, and it has continued to grow. And we really focus on the HIV STI component. That is that 20 hours of special education. In addition to the other competencies, we offer a specialty in HIV prevention and treatment. The coolest thing about a CHW is that it doesn't really matter what your specialty is in your certification course. You can literally step into any part of community health work for any health condition. So you like HIV and you think that that's nice, but you really have a desire to work in maternal health, you can use the CHW certification to move into maternal health or heart health or diabetes care or cardiovascular care. It really doesn't matter the health issue. Community health work is a part of that. So we offer this open door for community members to kind of get in, and then you can decide where you'd like to go after that. We also provide scholarships up to 100%, and we'll talk a little bit about that as we move forward in our slide sets. But pretty much that's what the course is. It is literally a way for you to be certified through the state and find some job skills or learn some job skills that'll help you easily move into the public health sector. If you look in or search up jobs for CHW, it's constantly on a rise because there is a gap in service delivery as well as to the community. So community health workers will be a bridge to the communities and the healthcare providers. Anything would you like to add, Latoya?
Yes, I would like to add that The class is 12 weeks and it sounds very long, but it goes by very quickly. We're very on hand, we're very hands-on in our class. It's very interactive and it's also a lot of fun. And not only will you be having fun, but you will be building your community, your own village, and meeting other men and women who want to make a change in their community.
Thank you. So who can apply? If you're on here, you probably can apply. But you have to be a Texas resident, so you have to live here. And then you have to be at least 16 years of age. I know we don't know that. People don't pub that often. But if you're at least 16 years of age, you can get this certification. So if you have a high schooler that may be looking to into the healthcare field, this would be something that would be really great for them to have right as they enter that post-secondary education, moving into college, having that kind of experience under their belt would be really good. They can easily use that as a way to find a nice little job while they're in college. And there are two certification pathways. One is the 160-hour certified training, which is what we're offering. And the other one is a 1,000 hours of community health worker experience, but that is usually for people who are being grandfathered in. The main way to become a community health worker is 160 hours of that DSHS certified training. If you have gotten an email from us about the CHW that we are offering, it literally lays out the entire week and the entire course and all of the competencies. So if you have not gotten that email from us, please go to www.randomblackgirls.com and you can get into our information and just send it over to us, or you can email us directly at info, that's INFO, at randomblackgirls.com. And we would gladly send you all of the very detailed information with live links so that you can sign up, or you can fill out for scholarships. We are currently open for scholarships and we will close that on the 5th of February. So our classes cap out at about 20. We could probably push maybe 20 to 25. But if you are a Texas resident, at least 16 years of age, and complete this course, you can become a CHW. Now, what a lot of people don't know about the field of community health work is out of 50 states, only 16 states certify their CHWs. We are one of those states. So you will be able to take that certification, whether you live in Austin, whether you live in El Paso, whether you live in Dallas, whether you live in Houston, throughout the state, this CHW certification is good for your work throughout. And a lot of the times, other states will also hire you and pay you more because you are in a state that is certified. Latoya, is there anything you'd like to add? So what are the benefits of the program? Latoya, would you like to expound on some benefits of becoming a CHW?
So some great benefits about becoming a community health worker is one, not only are you bridging the gaps between healthcare and your communities, you're also helping others become more advocating for their own healthcare needs. You're empowering individuals to advocate for their healthcare needs. And then you also gain valuable skills, workable skills, skills that are transferable into the healthcare system. And that's one of the things that Random Black Girls wanted to do, or Allure Alliance wanted to do, is make sure that when we come into the healthcare system, we come in contact with the healthcare system, we have people in the system that looks like us that can help us navigate whatever we may need, navigate the resources, navigate the landscapes, navigate the healthcare systems, because it is hard to do. And if you don't have the right people that can help advocate for you, it can make it a little bit more complicated. So There are some great benefits. You gain working skills, you gain a community and a village, and you also gain a self awareness of how you're giving back to your community.
I don't think I can add very much to that. I think that for me, one of the best benefits of becoming, because we also are CHWs, we are also CHW instructors. So as a CHW, it is good to be able to be that bridge, to be able to connect. And I think that as we look at where we are moving towards over the next few years, we definitely going to see a high demand for community health workers. So it'll be really good to see how many people we can connect to the community. I love to say to people, if you are one community health worker, if you work and use that as a part of your job skills, you will impact annually a minimum of 150 people. I think it'll be a lot more than 150, but let's just say that's the baseline. That means for everyone that comes through our program, they are touching 150 additional lives. And those lives are touching an additional 150 lives. Look at that ripple just move through our communities. And right now is the time to build communities and have very interwoven communities. So I think that one of the biggest benefits of becoming a CHW or of the programming is that you get to impact on a very long arc versus, just helping one person, that whole teach a man to fish type thing. It really just grows exponentially. So let's talk the money. I know a lot of people are like, how much is the course? What does it cost? What do I have to do? So when we're looking at paying for the course, we never want cost to be a barrier. However, we still have a cost for the course. So what we do is the full payment. If you have a job, it's a part of your job, it's a part of your job skill set, and you have an employer that's willing to pay, or you might pitch that you may want this kind of training. It is $750 for our course, which is, competitive, but also pretty cheap for the amount of training and the level of rigorous training that you're going to get. And we have a payment option, so you don't have to pay it all at once. And then there's also justification letters that we offer for people who want to try to get their employers to pay for your course, to justify the course and how it will be beneficial for your workplace to allow you to go through that training. Then we have a full scholarship option. So we currently have a rural scholarship option available for anyone who's in Bastrop, Caldwell, Williamson, and Hayes County. So we have a scholarship option that will pay 100%. Now's the time to get in on it. We have not closed out those scholarships yet. We will close them out on February the 5th. So please get in very quickly. If you don't know how to get to that scholarship, I will absolutely give you a link, but it's also www.randomblackgirls.com. There's also a link in our link tree that is in our bio if you're watching us on Instagram. And then we also have a GLBTQIA scholarship. The city of Austin gave us a Breathe with Pride grant. And as a part of the grant, we are offering scholarships for individuals that are in the GLBTQIA plus community because they have better access to their communities. And we want to make sure that we are providing bridges to care across all spectrums of the underserved, marginalized, I like to say historically excluded, but we have that for those two. That's what we have currently. We also have partial scholarship options, which covers 50% of the payment. And then what happens is we break that payment up over a series of weeks for those who are eligible. All of our scholarship options will close out on February the 5th. Because the course starts February the 10th. And everyone else, if you want to pay full price, we'll invoice you and you can pay it. If you want to pay in broken up in installment payments, we also will negotiate that with everyone on an individual level. We never want cost of this course to be a barrier. We do understand a lot of people are doing this in order to, move up in a financial way as well. So we don't want that to be a barrier, and we want to create access. Latoya, is there anything you want to add for paying for the course? So we have some Q&A time. It doesn't look like we have a lot of Q's to A. So what we're going to do is I'm just going to give you some FAQs that were often asked often. Okay. So will there be homework, and is it going to be hard? Yes, there will be homework. No, I don't think it'll be that hard. A lot of our homework that we offer in our course will be related to the subject matter that we're talking about that week, that we're training or teaching about that week. So if it is about presenting and teaching people, a lot of the homework will be around that. So it may be something as simple as we need you to develop a presentation for your subject matter group and your target audience, and we want to see what that looks like. That should be relatively easy. Not if you're scared to talk to people, but you know what? We'll work you through it. I've had nothing but wonderful feedback. Any of the feedback that we've had, because we collect feedback weekly, we've only been asked for more. I always look at the paperwork and say, y'all want more work? Lots of people have asked, can we have more of this and more of that? I have not had any feedback that said, we want less. Don't do that anymore. So, Latoya, is there anything you want to add about homework?
Yes, I would like to say we do homework. Homework is not just to give you something to do for this course, but what the homework does, it helps you analyze what you do in the real world and what you do in the work world, and how you'll be working as a community health worker. So if you're already doing community health work, the homework that you do is going to speak to you in a way that you're already doing. Also, when it comes to homework, it's important because it helps build your educational level around community health work, what community health workers really do. Some people come to our class and they're like, I've heard about community health workers, but I really don't know what they do. And then once they found out how vast and how many areas of healthcare you can go into, when we do our homework, it'll help you see how those skills are going to be transferable in your work skills.
Thank you. Another question that often comes up after people are enrolling into the course is field work hours. What are those? So we are required that you have some on the ground work experience. So that can be your employment that you already do, or it can be volunteer work, or if you just cannot find any of those things, you let us know very early in advance, and we can connect you to organizations that are often looking for either volunteers or to learn or to teach people how to engage with the community. Throughout this course, I believe there's 32.45 hours, so 32 and a half hours that is required. And weekly, you are to report about your fieldwork hours. So someone has to sign off on your fieldwork hours and making sure that, because DSHS is probably going to check your fieldwork hours. And that's a part of the 160 hours. So when you say 160 hours, it usually is, oh my gosh, that's so many hours. Those hours are cut up between homework, between live instruction, between fieldwork. So ultimately, we have you firing off on all cylinders so that when you get into the work, you're not surprised that you're going to do some paperwork and you're going to do some outreach and you're going to do some, on the groundwork, and you're gonna, help train other people, and you're gonna go synthesize information and give it to the communities that you're serving. So ultimately, we are breaking up that 160 hours into small chunks throughout that 12-week process. Any other thing you would like to add, Latoya, about field work hours? Okay, great. Last question that we're often asked is, well, once we complete the course, what is the process to get in with DSHS? So and you can do this as you go through the course, but we like to do it kind of at the end to make it really easy. You will have to fill out your CHW certification application. It can seem a little bit, arduous, so we walk you through that in the final week. We have to submit your names within 7 days of the completion of the course. And then we send you an email and say, submit your paperwork because DSHS has it. And then DSHS takes somewhere between 30 and 90 days. And after that 90-day, they will send you an email and they will send you a packet in the actual tangible snail mail with your ID, your number, a picture of you. Your contact information will be put onto the DSHS website, and you will be a registered, certified CHW. They'll also send you a certificate. We will send you a certificate, and we also do a end of the course completion celebration dinner. So for you and your family and or friends, we have everyone come in, we eat, we present you with your final certifications, and we celebrate you because we do understand that it is a lot of work, but you have committed for that 12 weeks, and we are celebrating you because you're going to go out into the community and change the trajectory of what is happening in your communities. Anything you want to add to that, Latoya?
The process isn't hard. It's just some paperwork, and the timing in between when they get back with you seems kind of long. But we'll walk you through that process again in the course. We'll have a day that we dedicate to walking you through how you fill out the application process if you're going to complete the course. We'll also, if you have been a community health worker and your license, your certification has expired, we can walk you through the process of what that looks like with your 1,000 hours and what part of the application process you fill out for that.
So just an overall summation of what we've covered today is that we have a CHW course. It will start February the 10th. It will go all the way to April, not August, April the 28th. And you can contact us at info@randomblackgirls.com if you have any questions and you're watching this later. We are www.randomblackgirls.com. We have a podcast. We have a website. We are invested in our community, and CHW allows for us to get into this community without the barrier of cost, of access, so on and so forth. We're doing our best to constantly have things for our community, our BIPOC community, our GLBTQIA community, our historically excluded communities, to be able to move into the system and change it from within. I want to add that I know that sociopolitically, we're going to be in a place where there's a lot of moving and shaking. But what I will say is that as a CHW, you will have a skill that will be in high demand, not only in the public sector, but also in the private sector. Places like pharmacies and places like health insurance companies and so on and so forth are always looking for CHW folks. And when you look at the rate of income, it can range somewhere between 45 and 65 entry level. So just keeping that in mind that this is something that's going to grow. You want to get in on the ground floor as it's continuing to grow. We're starting to see a lot of push, not only in the United States, but globally for community health workers. Another thing that we are doing is we're expanding outside of HIV prevention. We'll have some maternal health continuing educations that'll be coming up this year. And we're literally just adding on piece by piece all of these health options for community health workers as we move through the next year or two. So if no one else has any questions, we really appreciate you taking your time. Latoya, did you want to add anything before we close out?
No, thank you so much for your time and your attention. We look forward to seeing you in our community health worker course.
Thank you. Once again, my name is Dr. Sharita Ambrose, and this has been Latoya Swan, and we hope to see you in our course. If not this one, the next one. And if not that one, we would love to see you at any of our events that we have around the Austin area. Thank you. Oh, I see somebody put something on our live. Yes, the Fox Den. We are happy to have you. And we want you to be excited because it is an exciting experience. Well, thank y'all for coming out. God bless you. And we done. I thought that was easily done. I wasn't gonna do all like week 1 is this, week 2 is it. That's in the damn email.
I was streaming
Uh-huh.
and you couldn't see us. You could only see the PowerPoint, but I couldn't see the PowerPoint fully.
Well, I could see us at the top corner. There's a little square with our heads in it on mine. Either way, they got the audio. And then what I'm gonna do is also with the live that with the recorded part, I'm gonna put it in, what is the name of that shit? Opus Clip. It's gonna chop it up, and I'll also still just like push it out until the 5th of February.
Okay.
So let me stop recording this. Stop. And let me stop recording.